Me.
Really?
Mm-hmm.
So what do you do to do that?
Oh boy, we do a lot of things. We do a treatment called endermology, which is a mechanical massage that stimulates circulation. We do a new treatment called carbasi therapy, which stimulates circulation.
Carbasi? Oh, that's a great drink. Never mind. What is carbasi?
Carbasi is the injection of carbon dioxide, which is a naturally occurring substance in your own body, that draws oxygen to the area and breaks open fat cells, helps to mobilize the fat into the circulation so that you can get rid of it in areas that you otherwise couldn't get rid of it in.
She's too smart for me. All right, but anyways, you made a pre-tape. What is this about?
We're demonstrating actually carbasi therapy on someone.
Oh boy.
On
it
looks like
Botox to me.
No, here we are. We're injecting CO2 or carbon dioxide gas, which again is a naturally occurring substance in your own body. So the body actually responds to it by bringing the circulation to the area. If you bring the circulation to the area, then you're able to, once the fat cell breaks up from direct contact with the carbon dioxide, it's able to draw the fat out of the area and have it be burned by the liver and then getting rid of it throughout the body.
By putting carbon, not monoxide,
carbon dioxide, CO2.
It makes the blood come to that area?
Makes the blood come to the area. And then the CO2 actually breaks open the fat cell. The fat can go through the circulation and out of the body.
Is this better than Botox?
This is different than Botox.
Botox is a poison, actually.
Yeah, this is for getting rid of fat in areas that women cannot get rid of fat from. The saddlebags, underneath the belly, underneath the arms, bra fat.
How many pounds can you get rid of?
Well, fat doesn't weigh very much, so pounds are not really what you're trying to get rid of.
What's the effect of it then?
You're talking someone who wants to lose 2-3 inches on a frame in any particular area. It's pretty easy to do. It's pretty quick. It's without side effects. It's without any significant risk. It's really absolutely one of the best treatments for someone who is trying to lose those little teeny tiny pockets of fat. What we're doing here in this particular picture is we're actually treating stretch marks. This is an amazing treatment for stretch marks.
Really?
No one can get rid of stretch marks, but this will reduce the size and the appearance of stretch marks after true treatments by 50%.
And after that, the skin tightens up
What actually happens is that the stretch mark retracts on itself, and so it gets thinner. And the thinner it gets, the less obviously visible it is. It stimulates the strength of the skin underneath and allows that actual scar to come back on
And what do you
itself.
charge for a treatment like that?
It depends on the size of the area. It depends. So the larger the area, we charge per area. So
I thought maybe per poke there.
See, here we're doing a stretch marks.
Oh yeah. And then the blood will come that quickly. And then how long does the redness stay?
Do you see how it's getting pink?
Yeah, immediately.
Immediately, and that's because of the oxygen flow.
Wow.
Yeah, it's a fabulous treatment. This will
stay
red.
Is it permanent? Is it permanent?
The stretch mark, the improvement in the stretch marks is permanent, unless the person grows really rapidly, which is how you get stretch marks in the first place.
Mm-hmm.
Yeah, so that's particularly permanent. When we use it underneath people's eyes to tone up the skin and the eyelids and get rid of the bags under the eyes, the maintenance on it is about every 6 months because you can't stop the aging process. You can only sort of keep up with it.
Oh, darn, I thought you had the solution.
Well, I'm working on it.
You're working on it.
And when I get it, I'll come back.
Well, top secret. All right.
We also use it to get rid of the fat in the back that tends to hang over the jeans.
Do men come and do this too?
It works fabulously on men. And the reason is because men seem to respond so much better to anything than women do.
Why?
It's just the unfairness of life.
The unfairness. Oh, that's a clinical thing there. We got that down to a science.
It has something to do with Adam and Eve. And
Adam and Eve, that's something like that, that vine thing and the whole bit.
Exactly.
Okay, so what are some other anti-aging processes that you would recommend for women as well as men?
Well,
good diet, exercise.
Right.
Get your carbon dioxide, which I can get. Isn't that in the soda water too? But you get the sugar.
Carbonation.
Carbonation, or whatever. Well, you can go out and sniff the car.
You know what? The carbasi therapy was primarily used to treat people with atherosclerotic disease or narrowing of the arteries. That's how it was discovered. which is how they found it to be so safe. It now has a more aesthetic application, but
Is
it can
this,
be used
is this
for.
trend just starting now? Is this
Yes,
just starting to be discovered?
currently I'm the only one in New York City who performs this particular treatment. We have a training center for other physicians who come from around the world to train.
Really?
We do a lot of lectures around the world. It's very popular in Brazil and Venezuela and Italy, which is where it was primarily developed, and France. But we use it actually quite frequently for people who have thinning hair, especially women who have thinning hair, because that tends to be a circulatory issue.
You would poke it into the scalp and bring the blood to the scalp?
Yep.
And
within 2 weeks, new hair growth starts. It starts to
Really?
become thicker.
It's amazing.
It's
Wow.
really amazing. It will really be, I think it will probably be fairly big in about a year.
Because everybody will catch on to it.
I think everybody will catch on to it. And the lovely part about it is it's incredibly safe. There are really no side effects. The most you really can get is a little bit of bruising in the area where you stick the needle in.
Right, yeah.
And of course, you know, you need to practice proper sterile techniques, so it